So today's topic what you are going to see is femoral triangle, which is normally presented in the lower limb. So actually it is located in the upper one third of the thigh in the anteromedial side, which is something between the anterior and middle side of the thigh, because it is not completely related to the anterior thigh or medial thigh. It is presented anteromedial side, okay, and just below the inguinal ligament. So here you can see the femoral triangle. So this is the inguinal ligament. So below this ligament, this triangle is located. Okay. So coming to the boundaries of the femoral triangle. So above we have, it is a triangle, right? So base, two sides, that's medial and lateral side. So this is the base. So base we have the inguinal ligament. Okay. So coming to the lateral side we have sartorius muscle, medial side we have adductor longus muscle. So apex is the meeting point of these two muscles, that is sartorius muscle and adductor longus muscle. So these are the boundaries. Coming to the floor and the roof of the femoral triangle. So coming to the roof, we have skin, okay, superficial fascia and cribriform fascia. Here this fascia is something which appears to be, as there are some spores in the fascia, okay, cribriform fascia. Below that we have femoral sheath. Femoral sheath we will be discussing about it in the upcoming topics. And we have floor. The floor muscles are iliacus, tendon of psoas major, pectineus and adductor longus. Okay, see, these are the floor muscles. Floor muscles are iliacus, tendon of psoas major and pectineus and adductor longus muscle. Whereas roof, what we talk about is skin, superficial fascia, cribriform fascia and femoral sheath. Okay. So coming to the content of the femoral triangle, we have femoral nerve, femoral artery, femoral vein, femoral sheath, fibroelastic fatty tissue. Apart from that, we have lateral cutaneous nerve of thigh and genital branch of genitofemoral nerve and lymphatics. So actually, the femoral triangle contents up to this is normal. That is, we have femoral nerve, artery, vein, sheath. These are all common. What you want to remember is, you have to remember mainly the lateral cutaneous nerve of thigh and genital branch of genitofemoral nerve. So these two nerves are presented in the femoral triangle. So as I said, we are going to see about the femoral sheath. So this, now we are going to see about the femoral sheath. It is also one of the content of the femoral triangle. So it is the fascial tube around the femoral vessels. Vessels in the sense blood vessels or veins and arteries. Okay. So the sheath which covers the femoral vessels is referred as the femoral sheath. Actually, it is formed by the fascia transpalaris on the anterior side and iliacus facius as the posterior side. So these two fascia are involved in the formation of the femoral sheath. So coming to the compartments of the femoral sheath, we have medial compartment, intermediate and lateral compartment. The content in the medial compartment is the femoral artery and genitofemoral nerve. Okay, and it is the lymph nodes which is presented in the lateral compartment. In the intermediate compartment we have femoral vein. So actually this lateral compartment, we have the what is it, we have a canal that is referred as the femoral canal. Okay, so This femoral canal is actually presented in the lateral compartment of the femoral sheath. So, in the lateral compartment, we have femoral canal. Within the femoral canal, we have these lymph nodes is presented. Okay. So, this canal it mainly contains lymph node that is referred as collected lymph nodes. The canal with the opening of the canal is referred as the femoral ring. Closing of the canal is referred as the femoral septum. So coming to the relations of the femoral ring, we have laterally femoral vein, because see, in the lateral compartment we have the canal which is referred as the femoral canal. We have canal which is referred as the femoral canal. So coming to the relations, laterally we have this is the lateral side, this is medial side. So laterally we have the femoral vein. Okay. So that was V. Laterally we have femoral vein. Medially we have lacunar ligament. So anteriorly we have inguinal ligament. Posteriorly we have pectineus muscle. So in this picture you can able to see. So here we have the femoral canal. So posteriorly we have the pectineus muscle. Laterally we have the femoral vein. Okay. Okay, lateral, anterior, medially we have, so medially we have lacunar ligament, anteriorly we have linguinal ligament, posteriorly we have pectineus. So actually in the lateral side we have femoral vein, medially we have lacunar ligament, anteriorly we have inguinal ligament, posteriorly we have pectineus muscle. So these are the boundaries or relations of the femoral ring. So coming to the femoral hernia, it is one of the important clinical significance in the femoral triangle. So when the abdominal content protrudes to the femoral uh, canal, it leads to the femoral hernia. So something is bulged out due to herniated intestine. Some abdominal contents it protrudes to the femoral canal, which leads to the femoral hernia. So we can usually see the bulge of it. Okay, this is the important thing. And this femoral hernia is more common in females. Okay, and the direction of the herniation is downwards, forwards, and upwards. Downwards, okay, first, and forwards and upwards. So it is the herniation, the content which protrudes to the femoral triangle follows these direction into the femoral canal. Okay, so these are the important important things or important topics to cover in the femoral triangle. Okay, thank you.